he knows the importance of important role that the pharmacy people can play. That's what, because of his support, we could establish a vibrant pharmacy practice division in our 1,000-bed hospital, which has got more than 14, 15 super specialties in that. And he has been instrumental in, I mean, he has been telling us, you have to do more and you have to integrate into the system. And because of his support, if the pharmacy practice department and the program, 6-year program, which is going on in India, is taking place and getting eminence, it is all because of the visions of our Vice Chancellor, Dr. Satish Kumar Bhandari. And also, I would like to go on record, his predecessor also, Dr. Raman Shetty, was also telling you have to do. I think collectively we can do a lot of difference. I'm really grateful for his presence. He's a eminent ENT surgeon of the state, and he's very well known in his field. And I'm not going to read his biodata because it is like you don't eat your son. So that's how it is. And also, sir, very warm welcome to you. You have made my day. And also, I welcome all the oral presentation evaluators. We have Dr. Punashankar and Mahesh, Samir and Sridhar, Maheshwari, Saurabh Koshi, and also e-poster evaluators, Sargopan and Ramesh, Sunit Pawar and Shivabandari and Shivraj, Manjula, Tarachand, Viresh, Dilip Krishnan and Bhavya Sai. All these people have come together to see what are the oral presentations and evaluate them. And also, I think there are several e-poster presentations, and these are all the evaluators. I welcome all of them. And last not but least, I also welcome my learned colleagues of the college and from the university. I'm sure that many of them are greatly enthused what is going on and to find out. Welcome to you all, and welcome to my dear students and anybody who is interested. I'm sure that this today and tomorrow we are going to have very brainstorming sessions. And thanks for all of you. And from deep of my heart, I welcome all of you to India and NGSM IPS and Nitte deemed to be university. Thank you very much. Thanks, Sophia, for giving me an opportunity to welcome these great eminent persons of the field. Thank you very much.
Thank you, sir. Thank you so much for that introduction of, I think you've covered almost all our speakers. For the inaugural address, I welcome our Honorable Vice Chancellor, Professor and Dr. Satish Kumar Bhandari, Vice Chancellor of Nitte DU, who has always been a strong pillar of support in all our endeavors to advance research and development, to speak a few words. Sir, you're truly a visionary, and like sir said, we are eager to hear from you, sir.
Very good morning and good evening for our international guests. It's my privilege to be part of this very prestigious international virtual conference on advances in health economics and outcomes research. My international guests, Dr. Michael from University of Arizona, Dr. Mr. Kamal from University of Virginia of USA, and Mr. Tushar from Sheffield, UK, Dr. Dixon Thomas from UAE, Dr. Akram Mohammed from Australia, and our own Dr. Amit Dang from India, and my distinguished colleagues from our Pharmaceutical Sciences School, Dr. Shastri, and all the organizing team. I don't want to name each one of them because they have toiled for so many months to host this international conference. My dear students and faculty of Nitte deemed to be university and delegates. It's my privilege to be part of this international event, and I understand it is organized jointly by the International Society for Pharmacoeconomics and Outcomes Research, ISPOR, and our student chapter. I'm really privileged to be part of this program because our student chapter, which was started in the year 2017, is actively participating in this international conference. I congratulate the ISPOR International, which was started in the year 1995. I understand it was started as a small group of dedicated volunteers and visionaries and the purpose is to catalyze a very important part of the healthcare system to create awareness about health economics and outcomes of research around the world. I congratulate the ISPOR for doing this wonderful work. And I'm glad that Nitte University is part of this international conference, because the health economics and outcomes research is a new field. I think for us, Shastri will agree with me that it's a very nascent, in the very nascent stage. But internationally, for the last 3-4 decades, they are working on this internationally, they are working on health economics and outcomes, because they're a very important area. I understand the conference is aimed at creating awareness about the advances in health economics and outcomes research, and to sort out these issues of giving cost-effective health to people, particularly in the area, in the developing world. And India is definitely going to benefit by this awareness and by this program, which is conducted by the ISPOR. I'm really glad to note that health economics and outcomes research has grown exponentially as all the governments and all the players in health area, health dynamics are interested to find out the health outcomes of affordable and give every treatment at affordable cost. As you all know, health is it is a very growing industry in our country. Health is almost going to reach $40 billion by 2022. Unfortunately, 80% is provided by private sector, and largely the economy is this is funded by out of the pocket. Is provided by not by insurance, and most of the time, even though it's by insurance, by the individuals. And it's going to go further, because as you know, India is going to become a most populous nation by 2030, and the senior citizens are going to increase. I think they are going to reach 200 million by 2030, and the affordability of the people are also increasing, and government is also spending on health. Even though compared to West, we are spending around 4% of our GDP for health. The government is interested to take this further so that we can give health for all by 2030. And I understand, unfortunately, we don't have health economic evaluation of health. We don't measure it, how much the outcome of this spending on health. And that is one of the very important, essential part of the management. I think this type of programs can create awareness about this health economics, not only among the professionals, also the policy makers. They should be awakened, and they should be made to know that whatever we are spending, there should be good outcome out of what we are spending. And it's very much essential for a country like India, which has got one of the second largest population now, and by 2030 we are going to even cross China in population. I think this is very important program. I congratulate our Pharmaceutical Sciences School for conducting this program, and I thank the International Society for lending its helping hand to conducting this international conference. I understand there are very distinguished speakers, as it was narrated by our principal of the school, Professor Shastri. I understand very distinguished speakers are going to speak about various issues, including economics in management of COVID, which has really created havoc in the last 2 years. As you all know, Nitte University is mainly healthcare related university now. Out of the nine constant colleges, we have got 7 related to health, and we have got our flagship institute is our 1,000-bed hospital, which has got around 21 rural centers spread out in 4 districts, and we are providing healthcare for more than 2 lakh population every year in the periphery, in the villages, free of cost, and in the hospital around 5 lakh patients are treated in a reasonable cost, and we are providing tertiary care treatment in this hospital. And there is, I think we are spending around about more than 10 to 15 crores subsidized treatment for patients in this region. Really, Nitte is proud of giving healthcare for this to this region of world class and state of the art treatment we are providing. And during COVID, we had made this hospital part of this hospital as COVID care center, and we had COVID diagnostic lab and plasma therapy unit and COVID rehabilitation center. And we have a lot of social commitments we are providing and we are addressing by providing healthcare at affordable cost to the people. Thank you very much for giving me this opportunity. I wish great success for this international conference. Wish you all the best. May God bless you. Thank you, international guests, for participating in this event. Thank you very much.
Thank you so much, sir. Thank you, sir.
Thank you, sir. I just, Sophia, I just wanted to tell our Honorable Vice Chancellor, sir, that whatever he has told, we are watching behind this one on the screen to build a humane society through excellence in education and healthcare. All the audience who are watching, I'm sure that they have watched the vision statement, which is right behind you, sir. And I know you mean by that, and your vision and mission is our common goal. It is very apt that it is right reflected over there. Thank you, sir.
Thank you. Thank you.
Yeah.
Thank you, sir. Thank you so much. I think with that, we come to the end of our inauguration, and we will move to our first scientific session. Our first speaker for the day is Dr. Michael D. Katz, who is the professor at the Department of Pharmacy Practice and Science, University of Arizona College of Pharmacy. It is difficult to restrict my description about Dr. Michael because his area of interest span over a wide range of scientific domains. His research focuses on general internal medicine, endocrinology, HIV/AIDS, infectious diseases, and evidence-based practice. He has been the past chair of the American Society of Health System Pharmacists Commission on Therapeutics. Dr. Katz has secured numerous publications and is even a co-author of the book, Pharmacotherapy Principles and Practice Study Guide, a case-based care plan approach, now in its 6th edition. And this is a book that we recommend for all our PharmD students. In addition to all these elite accomplishments, Dr. Katz is the director of all residency-related activities for the College of Pharmacy. So you've been one among those who readily consented to speak at our conference, and we are very grateful for your time, sir. Over to you.
Thank you, Dr. Sophie. Thank you for that kind introduction, and it's really a pleasure for me to be with you today. Could you allow me to share my, oh, there we go. Now I can share my screen. Thank you. So thank you again for the kind invitation. Again, it's really a pleasure for me to be with you this evening here in the U.S. and this morning there in India. To be honest, I'm a little bit anxious about speaking to this audience because, you know, of course, I'm aware this is sponsored by ISPOR, and the main topics are health economics and outcomes, and that is not my expertise or background. So please be gentle with me, and I'll try my best to make this interesting and useful for you. Of course, as you've heard and as you see on the screen, my topic today is going to be about vaccination. And even though I'll be talking mostly about COVID-19 vaccination, really what I'm talking about, or the main theme that I'm talking about, is related to what should be the role of the pharmacist in vaccination, whether it's COVID-19 vaccine or not, with the idea that we really need to expand the role that pharmacists play for vaccination. So that'll be my main theme. I'll be trying to leave a little bit of time at the end if anybody has questions or discussion. Well, if any of you are wondering where Arizona is, this will tell you. So yes, I'm in the United States, and Arizona is in the southwestern part of the US, here in red. And where I am currently is in Tucson, which is the second largest city. It's the main area where the university is, and it's about 100 kilometers from the border of Mexico. So I can drive for 1 hour and be in Mexico. The capital of the state is Phoenix, and probably the most famous sightseeing thing about Arizona is the Grand Canyon, which is here in the northern part of the state. So if any of you come to visit us in Arizona, you certainly would want to visit the Grand Canyon. So at least now you know a little bit about where I am. So, of course, everybody, certainly everybody in India, and I think everybody in the world is very aware of what's been happening for the last year and a half with COVID. And I'm sure everybody is keeping up with what is happening in India and in other countries. Of course, this is a global problem, but I thought it might be interesting for you to compare what's happening or what has been happening in the US versus what's been happening in India. And what you see in the red graph are the number of cases of COVID over time. And then the green is the number of vaccine doses given. And it is interesting to note that the pattern of infection is very different in comparing US versus India. As you can see in the US, we've had 3 or 4 different waves or surges. And in India, of course, you've had 2 with the major one this spring. And it's very gratifying to see that the number of cases really has dropped very dramatically. And of course, that correlates with the number of people being vaccinated. Unfortunately, many people have died worldwide from COVID-19, but progress is being made, and again, largely due to vaccination. In the United States, we have about 60% of our adult population fully vaccinated. We wish it was much higher. And as you know, in India, you're at about 20% fully vaccinated, which is really tremendous progress, because when I gave a similar presentation in India, maybe, I don't know, a month or 2 ago, the rate of full vaccination was only about 4%. So you're really making really tremendous progress, and your country should be congratulated for that. Well, as everybody knows, this is a worldwide problem. This is not just an American or an Indian problem. It is a worldwide problem. And we know that vaccination rates vary tremendously from country to country. The countries with darker colors have the higher rates of vaccination. And these countries with higher rates of vaccination tend to be more affluent, higher income countries. These data are as of about 4 days ago, so they're pretty up to date. And you can see India, compared to other countries, is certainly doing better, moving up with, as I mentioned, about 20% of your population fully vaccinated. Worldwide, we're doing well in some countries, not doing so well in other countries. As you can see, close to 50% of the world population has received at least 1 dose of vaccine, but this is where there's a very big disparity among countries. As you can see from the slide, only 2.7% of people in low-income countries have received at least 1 dose of vaccine. So we have a very big gap between countries that are more affluent versus countries that are lower in income. So there's a lot of work we need to do to get more people vaccinated. Well, I think we all realize, and this is not news to anybody here, that the only realistic way out of any pandemic is vaccination. And the question for any country, and in this case for India, is, given your population of 1.4 billion people, how can you quickly vaccinate, ideally, the entire population of your country, so that you can minimize morbidity, mortality, and of course, development of other variants that might be more virulent. Of course, many of you already have answers to those questions. Now, since I am talking to an ISPOR health economics and
you write a hi, you can block Bharat sentence. It is a link, no, yeah.
If you could mute your microphone, that would be very helpful.